Welcome to the training for healthcare professionals. Let's begin with the module which focuses on assisted bath. Let's take a look at the key learning objectives. After completing this module, you will be able to explain what an assisted bath is, assist a patient to take a shower or a tub bath. Let us understand what assisted bath is. Bathing removes sweat, oil, dirt, and microorganisms from the skin using soap and water. Assisted bath means bathing with the help of medical assistance or a caretaker. Types of assisted bath. 1. Tub or shower or a bucket bath, where a patient is assisted in bathing or taking a shower. 2. Partial bath. Assist patient to wash and clean legs and perineal areas that he/she may not be able to reach. 3. Bed bath. A bath given to a totally dependent patient in bed. Let's find out the importance of bathing. Cleansing skin is the first line of defense against microorganisms. Click on the image to know the purpose of bathing a patient. The purpose of bathing a patient: removes microorganisms, helps nurses do physical assessment of the patient, increases blood circulation, improves self-image, provides comfort. Let's find out for whom and when assisted bath is required. 4. Weak or dependent patients needing assistance with bathing, Alzheimer's, dementia patients. When? Routine activity for inpatients at least once a day, whenever requested by the patient. Item checklist. 1. Soap and container. 2. Bath towel. 3. Bath mat. 4. Washcloth. 5. Safety belt if necessary. 6. Large towel. 7. Stool for shower. 8. Talcum powder or deodorant. Now let's understand the procedure. Assist in shower. 1. Determine what kind of bath is needed: a tub, shower, partial, or bed. You can consult a doctor, or it may be based on the patient's wish. 2. Gather all supplies and provide for privacy. 3. Check with the patient if he or she needs to go to the toilet before bathing. 4. Ensure a non-skid surface. A rubber bath mat or adhesive strips could be used if needed. 5. Place a stool in the shower. Ensure that the shower spray is not centered on the stool. 6. Check the water pressure and temperature before beginning the shower. 7. Use a safety belt if necessary to assist the person into the shower stall and onto the stool. 8. Assist the cleaning of face, neck, ears, arms, hands, chest, lower body, back, buttocks, legs, feet, and between the legs, as needed, in the same order. Points to note for a shower bath. Encourage the patient to do as much of the bath as he or she can, but ensure that the patient doesn't fall or strain her or himself while bathing. After bath, dry the patient's skin, patting with a towel, and provide a back rub as illustrated. Assist in tub bath. 1. If the patient is using the bathtub, first fill the bathtub with cold water. 2. Check the water temperature using the inside of the wrist. 3. Use a safety belt to assist the patient to get into the tub. 4. Rinse the washcloth and squeeze out excess water. Wash the forehead, nose, cheeks, and chin. Wash the person's neck and ears using soap on the washcloth. 5. Rinse the face thoroughly. 6. Wash the arm with long, firm strokes. Begin with the arm farthest from you. Wash the underarm. 7. Have the patient rinse hands well. Assist in tub bath. 8. Wash the chest using circular motions. 9. For a female, wash the folds of skin under the breasts. 10. Wash the lower part of the body. Be sure to clean the navel area and skin folds well. 11. Be sure to check for any breakdown of skin, especially in the back and the buttocks area. 12. Wash legs and feet. Wash between the legs from front to back. Encourage the person to self-wash this area. Points to note. Tub bath. Help the patient get in and out of the tub slowly. Drain the water out of the tub before getting the person out. Dry the person in the same order as washing. Face, neck, ears, arms, hands, chest, lower body, back, buttocks, legs, feet, and between the legs. Use any talcum powder, deodorant, or other personal grooming aids as requested by the patient. Assist the patient in dressing. Wash hands. Reporting the following. During bathing, observe and report to the doctor any of the following: color changes of the lips, skin, nail beds, and whites of the eyes; rashes, dry skin, bruises, broken skin, reddened areas, abnormal skin temperature; drainage, bleeding, complaints of itching and pain; excessive hair loss. Now let us see a demonstration on assisted bath.
Let's talk about ADLs. ADL stands for Activities of Daily Living, and it refers to all the activities that you and I and your care receiver need to practice, and that includes bathing and dressing. Helping out your loved one with ADLs can sometimes be a sensitive issue because sometimes it can make him or her feel exposed, embarrassed, or vulnerable. If your loved one has dementia, it can also include fear of the activity itself. Therefore, approach your loved one with respect, patience, and in a gentle way. Some things to remember are: go easy and don't rush anything. Create a safe environment. Allow your loved one as much independence as possible as you stand by. Gently talk through all of the steps you're taking. And if your loved one has dementia, he or she may need more prompting and help throughout, so show and tell and sometimes guide his or her hand in the task. You can help your loved one to bathe in one of 3 ways: using a shower, a tub, or a sponge bath. No matter which of these you use, your bathroom should be equipped with grab bars, a detachable shower hose, and a bath chair or bench. These will help prevent falls and make bath time a lot easier for you. Start the bathing process by gathering together all the personal care supplies you'll be needing. Make sure you have a safe, warm, and dry bathroom. Remove any objects in the way of your loved one's path. Place a bath mat outside of the tub or shower, and a rubber mat on the tub bottom or shower floor.
Hey Jimmy, you ready to take a shower? I'm doing it.
When showering your loved one, choose warm water and mild water pressure. And if he or she is shy, drape a large towel around his or her body. Guide him or her gently to the seat or to the grab bar if standing is preferred. Let him or her feel the water temperature and handle the shower head if necessary. When washing the hair, it's best if your loved one is seated. The detachable shower hose and a well-placed washcloth can help keep soap away from the eyes. Make sure the bath is thorough by cleaning under all folds of skin. After the shower, gently help your loved one onto the floor mat. And wait until he or she is out before turning off the water. You don't want your loved one to get chilled or scalded. Lead him or her to a nearby chair or even the toilet seat, and you can begin the drying process. You won't need to give a daily shower or a bath to your loved one if you routinely give him or her a sponge bath. This is a quicker alternative, and a good one if your loved one is afraid of stepping into the tub or the shower.
Okay, we're going to wash you off.
Have your loved one sit on a towel-covered bathroom chair or toilet seat, or stand at the bathroom sink. Fill the sink with warm water and add a bit of soap to it, not too soapy, however. Now, using a few washcloths, start washing your loved one from the top and work your way down the body. Again, let your loved one do as much as possible by showing, telling, or guiding. Now, refill the sink with fresh warm water, and with clean washcloths, remove the soap by wiping down the body all the way once more. And if you're really looking for alternatives, you can bypass traditional bathing altogether by choosing from a variety of waterless body washes and dry shampoos now on the market.
Ready?
A gentle lotion is really good for dry skin. You can apply it over your loved one's body, including feet and hands. Massage it in, then towel off the excess. And don't forget to apply common cornstarch under folds of skin to keep areas dry and rash-free. If your loved one has routinely visited a barbershop or a beauty parlor in the past for nail or hair care, he or she may prefer these services over the same care at home. However, if you take care of your loved one's hair and nails at home, the best time to do this is right after bathing. Make sure your loved one's hands and feet are dry, and take time to inspect them for any irregularities. Use a nail file regularly to keep finger and toenails at manageable lengths. But if you must cut them straight across with a clipper, then file the edges down. Cuticles can be simply pushed back with a towel. Shaving in general is best done with an electric shaver. Your loved one can use it safely, plus it can provide him or her a measure of independence. If you must use a safety razor, however, you are the one that should be doing it, and not your loved one. After bathing and grooming, it's time to get your loved one dressed. Keep your loved one's wardrobe simple, with easy-to-manage pull-on clothing and fasteners using Velcro, elastic bands, or large buttons. Lots of zippers and small buttons will be frustrating or confusing. If your loved one can still dress independently, you might lay clothes out so that he or she won't have to make choices that can so often lead to frustration. And lastly, your loved one's shoes should be low-cut with soles that are lightweight and don't tend to slip. Remember that when you're helping your loved one with bathing, dressing, grooming, leave plenty of time. Take plenty of time. And if your loved one doesn't want to cooperate, just stop. Take 10 minutes, even a whole day, and try again. Because in any caregiving activity, your watchwords should be patience and acceptance.
Points to remember. Keep the bathroom warm to prevent the patient feeling cold. Always use good posture to avoid hurting your back. Use standard precautions as needed. Protect the person's privacy. Close doors, curtains. A bath should last no longer than 20 minutes. Drain the tub before the person gets out. Clean the tub before and after use. Always have non-skid footwear on the patient before moving. Always wash from the cleanest to the dirtiest.